If you seem to be worried all the time about things, you may have generalized anxiety disorder. Generalized anxiety disorder is the mental health disorder that includes excessive anxiety and worry that the person finds difficult to control. Common additional symptoms of generalized anxiety disorder are feelings of restlessness or of being keyed up, getting fatigued easily, having trouble concentrating, being irritable. But the most common symptom of generalized anxiety disorder is trouble sleeping. The worries, in general, are reasonable, but of much greater intensity than most people have. And the worry causes the patient to suffer mentally, or the worry causes interference with his work or with his family relationship or other social relationships. Generalized anxiety disorder is underdiagnosed because the sufferer is so used to worrying and suffering from the worrying that he or she doesn't realize it's not normal. Most patients with generalized anxiety disorder never get diagnosed. And also, the sufferer doesn't realize that there are very safe and effective medicines that can make a world of difference in the person's ability to enjoy his life. Many people with generalized anxiety disorder first take benzodiazepines such as Ativan or Klonopin for their anxiety, or perhaps they take sleeping pills to help them sleep better. The benzodiazepines, however, can cause daytime sleepiness and accident proneness. And there are other more effective medicines in the long term. Nearly every antidepressant, except for bupropion, is effective in treating generalized anxiety disorder. The antidepressants take longer to work than do the benzodiazepines, but ultimately they work better. And the most important thing about using benzodiazepines to treat generalized anxiety disorder is that the disorder in 50% of cases is accompanied by major depression. If a patient has generalized anxiety disorder and major depression, then benzodiazepines will actually make the depression worse. An antidepressant, however, will make both problems much better. So, if you have worries that are so severe that you can't sleep, that you can't function properly at work, or that you can't interact properly with your family, see your doctor and ask if you could have generalized anxiety disorder. One warning: health insurance rules may make it difficult for your family doctor to effectively treat generalized anxiety disorder. Many people have health insurance that requires that they be treated for mental health problems by a special group hired by the insurance company. If that's the case for you, then you should call your insurance company and ask them how you can get an appointment with a mental health person that they have a contract with. If you're suffering from extreme worries, I hope you'll consider that you might have generalized anxiety disorder and that treatment might help. Well, that's it for this visit. I hope you found it useful, and thank you for watching.